Thank you, Chairperson. Thanks for the WIROC team for accepting this paper. I'm going to present 5 functional outcomes of arthroscopic Bankart repair for anterior shoulder instability based on suture anchor configuration. The purpose of this study was to evaluate the functional outcomes and recurrence rate of shoulder instability following arthroscopic Bankart's repair. The study also evaluates whether the number and the position of suture anchors plays an important role in determining the functional outcome as well. So this is a prospective study. It was conducted between December 2018 to December 2021 with a sample size of 64 patients, 58 males and 6 females. Patients with MRI showing Bankart's lesion with at least one dislocation were included in the study. Patients with associated rotator cuff tears, large hill sacks, bony Bankarts more than 25%, multidirectional instability, voluntary dislocators, epileptic patients, and patients with connective tissue disorders were excluded from the study. All acute shoulder dislocations were reduced in the emergency and immobilized, and patients were asked to follow up in the OPD with the MRI. Patients were explained about the study, and informed consent was taken, and they were assessed preoperatively by SS score, DASH score, ROVE score, and instability severity index score. All patients were operated in general anesthesia in a lateral decubitus position. 50 patients had surgery done with 2 anchors. 3 anchors were used in 10 patients, and 4 anchors were used in 4 patients respectively. Remplissage was done in 16 patients out of the 64. Arthroscopic Bankart repair was performed using 2 suture anchors. Decision for the 3rd anchor was taken depending on the size and the extent of the detached labral tissue. Remplissage procedure was added if the lesion was found to be engaging in the glenoid in abduction and external rotation. Post-operative assessment was done at 2 weeks, 1 month, 3 months, and 6 months. Functional assessment was done with range of movement analysis, and pain assessment was done with the visual analog scale. In our study, in all the 3 kind of storing systems, we found that there was a significant improvement, statistical improvement at each and every follow-up at 1 month, 3 months, and 6 months. Then the patients were divided into 2 groups. One was with 2 suture anchors, and one group was with more than 2 suture anchors. And again, all the studies, all the scoring systems revealed that there was no statistical difference in between in our patients in whether 2 suture anchors were used or more than 2 suture anchors were used. A similar thing was done with the remplissage. So there was a group with remplissage and group without remplissage, and adding the remplissage procedure did not make any difference in significant difference in our patients. In terms of pain analysis, the visual analog scale improved from 5 mean preoperatively to 1, so there was a significant improvement at each and every follow-up in terms of pain relief to the patients. So there were no complications documented in this study. There was no redislocation. There was average limitation of external rotation of 5 degrees, and all patients had good functional outcomes after the arthroscopic Bankart's repair for the shoulder instability, anterior shoulder instability. And all our statistical analysis revealed that the patients had similar functional outcomes irrespective of the number of suture anchors used or with or without remplissage procedure. So the high dislocation rates in initial times have gradually reduced and now have become comparable to the open procedures. The addition of remplissage has gives us bipolar stability in cases of significant hill sacks defects. The concept of on-track and off-track has revolutionized the way we approach our anterior instability patients. So in terms of loss of external rotation, there are a lot of papers which state that there is usually a loss of around 3 degrees to 5 degrees of external rotation, which is the similar, our results are similar, and they show 5 degrees loss on an average. In terms of adding more anchors, there have been a lot of papers which will tell you that there should be more points of anchorage and you should use minimum 4 anchors. But this was not what we observed. According to our study, the number of anchors did not determine the final functional outcome, as majority of the patients in our study were operated using 2 or 3 anchors. So again, there are a lot of studies which will show the same. So in conclusion, our study shows that arthroscopic Bankart's repair for anterior shoulder instability is a useful and a successful procedure. Proper patient selection, intra-op evaluation and assessment remains the key to determine the success of the repair. Meticulous surgical technique, correct positioning of suture anchors plays a crucial role in improving the final outcome and may also help in reducing the number of suture anchors, thereby reducing the economic burden on the patient and the healthcare system. Thank you.